Robotically assisted intervention is a really interesting topic, and it's one that we're featuring in CardioSource Interventional News. So what I would like to do is introduce you to University of Arizona down the street from where I'm actually living in Phoenix, Dr. Sugam Bhatnagar. And let's talk a little bit about, first off, the group of people you're specifically looking at using a little robotics.
Yes, so this poster is about a combination of technical approach using robotics as well as multivessel stenting for patients who suffer with multivessel coronary artery disease. These patients are at a higher risk, and a combination of this technique provides an added advantage of longevity that comes as part and parcel of a coronary artery bypass approach, and the vessels that are difficult to access from the lateral wall can be easily stented. These lesions are usually of the lower degree as well as focal, and so stenting is a good option. The robotic approach is a minimally invasive approach, and over the last couple of decades, it has shown great potential in terms of a higher degree of preference from patients as well as quicker recovery. As part of this study, we are looking at how patients do 3 weeks post-operatively and comparing that in terms of recovery in open heart or sternotomy incision patients. So in essence, the poster is about following up patients after the surgery at 3 weeks and documenting the status of their recovery.
I mean, logically speaking, if you can avoid the sternotomy, let's do it.
Yes.
And you're doing something that requires some intervention, just a little more than a regular PCI approach. About how much of an intervention are you talking about?
In terms of incision, the robotic approach is through a camera and ports to work inside the thoracic cavity. But we use a mini thoracotomy approach to do the hand anastomosis. This procedure is called as endoscopic traumatic bypass, and we standardized it for all the patients participating in the study. The advantage that hand anastomosis offers is that it gives you a confidence when you make the anastomosis in terms of reserving the plaque and ensuring the quality of anastomosis. Then, of course, the advantage of bypass surgery is in terms of longevity and avoiding future lesions. That is, a potential drawback for stents.
Now, patients, I have to assume, are going to be really happy with this because they're avoiding a large incision. How about doctors? Is it really tricky to maneuver this stuff, or are they kind of happy with this new option too?
Well, so there are two ways to look at it. Historically, if you see, the syntax trial clearly implied that bypass surgery is a superior option to PCI, but still patient preference does play a major role into this game. And over the last 10 years, PCI volumes have almost doubled to tripled, while surgical volumes have gone down by 50%. So there is this trend that is a part of minimally invasive transition in interventional approaches. The second point is about patient satisfaction. So patients that were a part of this treatment, we collected patient satisfaction scores as part of Press Ganey surveys and HCAP surveys, and the patients were very happy with the procedure. We had scores in the 95 to 99 percentile of all patients. So these patients were of the top 1 percentile in terms of their happiness of undergoing this procedure and the treatment they received.
So for robotically assisted surgery, you think there's a future here?
I do think that there is a future, just because we are too short in the curve for robotics. CABG surgery has been the gold standard. Open heart surgery has been the gold standard for the last 30-40 years. There's long-term data. There's clearly a dearth of robotics data in that sense, since it's only been at the horizon for 5 to 10 years. So we are pursuing that very aggressively, making sure we have 2-year, 5-year, 10-year follow-up on all patients, because that is imperative to the success of robotics, as well as for finding out how patients do long-term. It's definitely a controversial topic, and I believe robotics has great potential, And it's not just about how patients do, but also in terms of technology. 20 years back, if you go 20 years back and you talk about computers where you would have a computer on your palm, it would be you would be touted insane. But now cell phones can do almost everything you want that a computer can. So it's 10 years down the line, robotics could offer a lot more than it does right now. It would have a lot of acceptance. Learning curves would be shorter, and there would be much better outcomes.
Well, you can see more about robotic interventions in CardioSource Interventional News, and I'm Rick McGuire.